Yoga for vertigo. This exercise can reduce and cure vertigo and tinnitus, caused by diseases that do not require emergency medical intervention. However, you should see your doctor soon to get a diagnosis and follow up on adequate treatment for your illness. Part 2. Kneeling meditation, Vajrasana. Before practicing different techniques during the practice session, please meditate while kneeling for a few minutes, using the technique described in Part 1. If necessary, you can pause the video to meditate. When you are ready, come back, reopen the video and practice with me. Now, if you are ready, let's practice with me. Headstand, Shirshasana. You will put your head in this position. The head and hands will form an equilateral triangle on the floor. Now focus your consciousness on the practice. You put your head on the ground, your hands on both sides. Both feet move towards the head, lifting the buttocks as high as possible. Each leg is lifted in turn. The legs were still close to the buttocks. Keep your balance, then slowly straighten each leg. Now when you straighten your legs, breathe slowly and deeply, with your lower abdomen, for several cycles. This is a pose that works very well for treating various types of cerebral blood circulation disorders, directly treating your vertigo and tinnitus. In order to get rid of this pose, we first bend the legs near the buttocks. Let's put each foot on the floor in turn. The head is still on the floor. We turn to the child's pose. Child's pose, Balasana. We put the forehead on the ground. We relax the upper body on the thighs, hands back. Breathe uniformly, slowly and deeply with lower abdomen during many cycles. Shoulder stand, Sarvangasana. We bend the body to one side to lie on our backs. The hands that support the hips are as high as possible, the shoulders firmly in place on the floor. We extend each leg to the ceiling. Now, we combine the strength of the two shoulders, the arms, the spine and the straightening of the legs, gradually resting on the shoulders, feet pointed towards the ceiling, hands supporting the back. Breathe, slowly and deeply with the lower abdomen, several cycles. Breathe, slowly and deeply with the lower abdomen. Plow pose, Halasana. To move to the plow pose, we slowly lower our legs to the back of the head. The back and neck muscles continue to stretch. If possible, put your feet on the floor. Put your hands to your feet. Try to completely relax the muscles except to maintain the pose. Now, while it may be difficult, try as much as you can. Continue to breathe slowly and deeply with the lower abdomen, more cycles. You can put your foot on a solid object like this. Make sure it does not fall on your face during practice. In order to get rid of this pose, we use the hands to support the buttocks to lower us gently to the ground. If you need it, you can lie down and rest for a few cycles of slow and deep breathing with your lower abdomen before proceeding to the next poses. Bridge pose, Setu Bandha Sarvangasana. We do the bridge pose, but instead of resting on the shoulders, we press the back of the head directly on the ground. Two hands can support the buttocks. Breathe evenly, slowly and deeply in many cycles. Regulate the spine. This technique has been clearly stated in Part 1. This is a very necessary technique to adjust the entire spine and stimulate the central nervous system along the spine, which positively affects the healing process of yours. Practice this technique for a few minutes, in combination with the breathing of the lower abdomen to match your rhythm of movement. Lying meditation, ear plugs. Now we turn to lying meditation. Lie on your back, comfortable on the floor. We use 2 thumbs to press the so-called tragus, to plug both ears. Loosen the jaw. Close your eyes, direct your thoughts to the back of the neck and clearly hear your breathing. Breathe slowly and deeply with the lower abdomen, several cycles. Savasana, corpse pose. Finally, to finish the practice, continue to relax comfortably on the floor as above, but you do not need to focus on the breath or any other physical or mental activity. Now, all the muscles of the body are released, the whole mind is released and free to enter the unconscious state. I wish you to practice well, heal quickly. Thank you, goodbye, and see you soon.